So in medicine, we have this concept of bioavailability, which basically is a term for the proportion of a drug that's given to a person that is actually ends up being absorbed in the blood. When it comes to administering ketamine as an injection or as an intravenous infusion, the bioavailability is greater than 90%. That means that very little of the ketamine is not absorbed into the blood. However, when we give ketamine or a version of ketamine administered nasally, the bioavailability is typically less than 50%. So we lose more than half of the drug since it doesn't reach the blood system and therefore the brain. The blood levels that typically are achieved with Spravato are lower than the blood levels that we typically will end up with when we are treating patients with ketamine. Because when it comes to ketamine, we have unlike Spravato, we have no restrictions. We can adjust the dose and find a patient's optimal dose, and we will do that. That's one of the things that we really focus on at Kadima, is sort of individualizing the treatment for patients, finding the patient's optimal ketamine dosage and the optimal way to administer it. Now, when it comes to Spravato, we don't have the same degree of flexibility because Spravato comes in fixed doses. There are only 2 doses, so we can take one single dose jump if the initial dose is not enough, and we cannot go beyond that. So we don't have the same flexibility to overcome the reduced absorption. The end result is that some patients achieve a blood level that is adequate for therapeutic effects for them, because every patient is different. But there's unfortunately a lot of patients that don't achieve the blood levels that are optimally therapeutic for them when they are using Spravato, and yet when we use ketamine, they are able to obtain those optimal levels and get those optimal therapeutic effects. So Spravato, while it is a breakthrough in terms of its financial benefits being covered by insurance, doesn't represent in any way a breakthrough in terms of therapeutic effects or in terms of achieving higher levels of symptom reduction. In fact, it's probably can be considered sort of a weaker version of ketamine. So there are 2 ways that patients can commonly incorporate the financial advantages of Spravato into their treatment regimen. Some of our patients decide to start off using Spravato if their insurance covers it, and they can try to see if that works first, and if that doesn't work, then they have the options of moving to a treatment that involves actual ketamine and giving it intravenously or intramuscularly, the more effective ways of administering it. The downside to that is that if Spravato doesn't do the job, they've lost several weeks of experimenting with Spravato. Spravato does require twice weekly treatment for 4 weeks before determining how effective it is. So it would be a 4-week trial, and if it's not effective, you can think of it being being behind 4 weeks in terms of that journey towards a better life. On the other hand, if it works, it's a great situation for patients because they'll have it covered by insurance. So financially, it's optimal, and they're also getting the benefits. Another way patients use it is going the other way. They'll start with ketamine. They'll maybe want to get to that therapeutic effect as fast as possible. And they may want to know just to what extent ketamine can be a game changer in their life. So they will start with ketamine. They will endure the disadvantage of not having insurance coverage and pay the out-of-pocket price. And if ketamine is effective and maintaining it is cost prohibitive, we can work with them to try and figure out a strategy where maybe they can convert to Spravato for maintenance, for keeping them well, or perhaps some sort of combination between the Spravato and less frequent ketamine treatments. So we work very diligently to try and find ways that our patients can get the benefit of this whole ketamine treatment breakthrough, and also avoid paying more than they necessarily need to.